All right, hello everyone, and welcome to IngMar Medical's webinar on using the ASL 5000 lung solution to manage a post-op patient. My name is Brian Lin. I am the product manager at IngMar Medical, and I will be the host for today's webinar. We've tried to make today's presentation as concise as possible to be cognizant of your time. So we will try to limit the duration to about 30 minutes. The first 20 minutes will be the presentation, and we will leave at least 10 minutes at the end for Q&A. We will be muting everyone's audio during the presentation, but please feel free to submit questions at any time using the chat panel through Zoom. We will answer as many of your questions as possible after the presentation. As always, a recording of the webinar will be made available to you via email. You can also access the recordings for any of our previous webinars under the training section of our website. We will be distributing a survey via email as well, so please let us know how we can provide you with the best possible webinar experiences going forward. The purpose of today's webinar will be to demonstrate how the ASL 5000 lung solution can be used to run a hands-on ventilator management training scenario. We will view a pre-recorded simulation featuring a patient who has woken up from sedation after surgery. The learner will be expected to assess the patient's condition using the LLEAP Patient Monitor and the information presented on a real ventilator. We will be provoking changes in our patient's condition using the LLEAP Instructor application. One of the main purposes of today's session is to demonstrate the way in which we can structure scenarios of this kind using LLEAP themes. I'd like to start by providing a quick overview of the approach we take to creating simulations with the ASL 5000 lung solution. At the heart of the lung solution is the ASL 5000 breathing simulator. The ASL 5000 contains a piston moving inside of a cylinder. The movement of this piston is used to generate realistic breathing patterns, which represent a nearly unlimited number of respiratory conditions. And with the ASL 5000 lung solution, we are able to control the movement of the piston with the Laerdal LEAP software. Through the LEAP software, you can select one of our pre-programmed respiratory disease states from the Quick Choice menu. And for each disease state, you are able to adjust the severity from mild to severe. This is the easiest way to incorporate realistic respiratory disease states into your scenarios. But you still have full control over the ASL 5000's respiratory parameters. The lung model control window allows you to make fine-tuned changes to resistance and compliance. In order to create disease states at the highest level of realism, we also provide users with the option to expand the number of resistance and compliance parameters available. Users can define inspiratory resistance independently of expiratory resistance in cases such as asthma. And heterogeneous lung conditions can be simulated by setting a compliance for each lung. The breath effort control window allows you to control the patient's effort to breathe spontaneously. The advanced view of this window even allows users to define the patient's I/E ratio. Today's scenario will demonstrate a feature which can be used to allow these changes to be applied gradually. But otherwise, these adjustments to the patient's condition take effect immediately, allowing the instructor to provoke the intended patient-ventilator interactions and allowing the learner to make necessary adjustments to the ventilator without interruption to the scenario. Because the windows used to control the ASL parameters are built within the standard LEAP Instructor application, they exist alongside all of the windows that are standard to the LEAP environment. This means that users can complement the respiratory disease states simulated by the ASL with various LEAP windows that provide the learner with additional information used to assess the patient, such as the LLEAP Patient Monitor, used to display vital signs information, and the Sounds window, which contains a library of lung sounds. While it is fairly easy to make changes to these parameters individually during a simulation, we understand that our users would also like to have a more structured approach to running scenarios. Recently, we have learned the ways in which we can use LLEAP themes to provide more structure to our ventilator management training scenarios. The scenario you're about to see employs this approach. Themes allow users to preset all of the parameters contained within the standard LLEAP windows, such as the patient's vital signs, so that these are combined into states that represent the patient's condition at a particular point in the scenario. Theme states also allow instructors to input notes on what to look for when the student begins making changes to the ventilator. This way, they are prepared to move to the next state when appropriate. If a change in the patient's respiratory parameters is necessary during the scenario, the instructor can be prompted to make these changes in the ASL windows as well. In this way, we're able to build the story around the breath patterns while providing the student with the most comprehensive and immersive learning environment possible. When you bring it all together, you have a high-fidelity mannequin simulator, which can be intubated and placed on a real ventilator for hands-on training scenarios. Our goal is to make the learner feel like they're in a real ICU, faced with the anxiety of treating a critically ill patient on a ventilator. Now let's take a look at today's scenario. Before we begin, I'd like to give you some background information on our patient. Our patient is a 22-year-old female who just came out of the operating room for an appendectomy. She was previously healthy, and she is currently unresponsive to all stimuli and needs full ventilator support. To run this scenario, we have created a theme within the Laerdal LLEAP software. A theme allows us to preset the vital signs displayed for the learner on the patient monitor during the simulation. It also allows us to prompt the instructor to make the necessary changes to the patient's respiratory parameters using the ASL 5000 plugin windows. As we begin, a pop-up provides the instructor with the information necessary to set the stage for the scenario. Here, we are instructed to go to the Quick Choice menu and select our adult normal patient. Then we will go to the breath effort control window and change the effort parameter to 0, representing our fully sedated patient. Please note that while the patient's effort is set to 0, the rate parameter displayed on this window is irrelevant as the patient is not breathing spontaneously. The patient monitor will continue to display the correct total respiratory rate for the learner, as this is controlled by the ASL 5000's pressure sensor that is detecting the rate delivered by the ventilator. Finally, here we are provided with the initial ventilator settings that will need to be applied before presenting the learner with the scenario. We will set the ventilator to the volume control mode with a tidal volume of 450 milliliters, an inspiratory time of 1 second, a rate of 16 breaths per minute, and a PEEP of 5. Now that the initial conditions have been set, the learner should make some observations on the ventilator. The learner should recognize that the patient is not making an effort to breathe on their own, and otherwise she seems to be in a stable condition with a healthy minute ventilation. The learner should also be observing the patient monitor, which provides further indication of the patient's stable condition. As you can see in the theme control window, the instructor is expected to proceed to the next state after the learner has made these initial observations. The next state will prompt the patient to begin waking up and showing signs of distress. After activating the waking from sedation state, the instructor is provided with a message which guides them back to the breath effort control window. Here, we will turn up the breaths per change feature to allow the subsequent adjustment to be applied gradually. Then we will change the effort to 14 centimeters of water. We will also change the rate to 25 breaths per minute. You will see the effort and rate parameters begin to trend up, representing a patient who has woken up and is becoming distressed. By activating this state, we have automatically provoked a change in the patient's vital signs as well. The learner will be able to view the patient monitor, which shows that the patient's heart rate has increased significantly. The learner should also observe that the ventilator is alarming due to high minute ventilation. The learner may also observe the fact that the total rate is above the set rate, indicating the patient is breathing spontaneously. Our theme control window tells us that the doctor has requested a spontaneous breathing trial, and the learner is now expected to switch the mode to pressure support. When the learner correctly applies the new ventilator settings, the instructor can move to the next state, titled Spontaneous Breathing Trial. Here, we are instructed to change the effort to 8 centimeters of water, and the rate to 15. This allows us to simulate a patient who is no longer in distress. As the patient's effort and rate continue to trend down, the learner should observe that the minute ventilation is trending down toward a normal value as well. With the activation of this new state, we have automatically applied a new set of values that will be displayed for the learner on the patient monitor. Now, the patient's vital signs and the ventilator data should both be clear indications that the patient is more comfortable. After approximately 20 minutes on these settings, the learner should conclude that it is time to extubate the patient. This concludes our scenario today. Thank you for watching. Okay, thanks again everyone for taking the time to watch today's scenario and to join us. But at this time, we would like to open the floor to questions. We have one of our clinical educators, Jessica Dietz, here to help us out from a clinical perspective. And yeah, please ask away in the Zoom chat area. So we do have a couple of questions here related to the cost of the system. Because that is dependent on your region, we will need to contact you when the webinar has concluded. You will actually, as we mentioned, receive a survey that would allow you to acknowledge the fact that you would like to receive more information on the product. And in that case, you would be contacted by a representative with that information. We have another question here from Tom. Tom asks, how does the ASL hook up to the SimMan? Can a center install it, or does it have to be installed by Laerdal? So that's a great question, Tom. The ASL does require a physical component to be integrated with the SimMan. We call that the lung adapter. The lung adapter is a piece of hardware that is installed inside the torso of the SimMan, and that installation is done by Laerdal field service engineers. So when you are speaking with Laerdal about purchasing this product, one of the discussions will be about that installation. After that installation is complete, the component can stay in the mannequin because it actually acts as a toggle switch so that you could easily revert back to the standard SimMan configuration. In the end, that means that once it's initially installed, it never needs to be taken back out. We had a question from someone who joined a little late here. Josephine asks, does this come with SimMan? So this is an option now for the SimMan 3G family. In fact, the lung solution is compatible with 4 different models of the SimMan, and that would be the 3G, the 3G trauma, the essential, and the essential bleeding. So any of those mannequins would be able to be integrated with this solution, but it is an additional piece that would need to be discussed with Laerdal. So here's another question. William asks, where do you create the change states in the LEAP software? So the environment used to create the theme, as we had demonstrated today, is called Sim Designer. So that's actually the environment used to create themes as well as scenarios. So that's where you would need to go for that. And this is kind of a question adding on to that. Glenn asks, I'm guessing that nothing limits us to themes rather than scenarios. And yes, that is absolutely correct. You could take a very similar approach to what we had done today using a scenario rather than a theme. Okay, another question here from Richard. Will this work with most ventilators? That's a great question. The answer is absolutely yes. We are the universal patient, so to speak, and that means that you can use any real ventilator, and not just any real ventilator, but any mode of ventilation. Our ability to produce these realistic spontaneous efforts means that you can train on spontaneous modes of ventilation. Okay, so here's another question from Josephine. Would you give our team training if we purchased it? Yes, training is an option as well. And again, this conversation about what needs to be purchased as a part of the system would primarily happen with your Laerdal representative. But we do have 2 different forms of training available. One would be online training, similar to what you're going through today, but it would be a little bit more personalized, and you would have a chance to interact with the presenter. And the other option would be in-person on-site training. So both of those options are available for this solution. Both of those options, by the way, are delivered by IngMar Medical. So we're working very closely with Laerdal here to coordinate those efforts. Okay, we have a question here from Melissa. Can it be used with non-invasive positive pressure ventilation? Yes, it very much can be used for that purpose. We are able to produce these spontaneous breaths that really result in real negative pressures that are sensed by a real ventilator, for instance, but also a non-invasive mode or a mask could be used to deliver positive pressure ventilation. Similarly to an invasive mechanical ventilator. Okay, so a question here from Tom. Will live gases from an anesthesia machine cause damage to the ASL? So that is a good question. The answer to that is yes, potentially. You are, as the user, required to use only compressed air to run the system, which means 100% oxygen is also causing a potential harm to the internal components of the SimMan mannequin. And similarly, these anesthetic agents would not be able to be introduced to the internal components of the ASL. So that would be a limitation there. So we have a couple questions here regarding the scope of mannequin integration available. And essentially, these questions are asking if we are currently limited to adult mannequins or if there is an opportunity to integrate with pediatric or neonatal mannequins. Currently, we are compatible with those 4 mannequins that I mentioned, the 3G trauma, essential, and essential bleeding. So those are all adult mannequins. But our goal is to expand that as we continue this relationship with Laerdal. We would very much like to be able to integrate with an expanded number of mannequins. And the ASL 5000 itself is certainly capable of producing breath patterns from neonatal to adult. So that functionality already exists with the current ASL 5000. So we would very much like to move in that direction. So Margaret asks, can the training be incorporated for a group of students, or is this an added cost? So we typically recommend limiting the group to 10 people or less, just to have the most effective training experience. But that's something, your needs for training would certainly be discussed directly with our clinical educators, so that we would understand what you need, and so that we can discuss with you how to accommodate that. So Jean-Paul asks, is it possible to simulate any kind of patient, including ARDS and COPD? Virtually any type of respiratory condition can be created, and this is due to the fact that our range of settings that can be applied is very wide and almost limitless. So our resistance and compliance settings would represent any condition that you could imagine in terms of ARDS or COPD. In fact, ARDS and COPD are both standard disease states that are included with the purchase of the system. So you can actually run those from our library and adjust the severity. But yes, virtually any type of patient. And if you're curious about other specific types of disease states, please let us know, and we can talk to you about how that can be accomplished. There's a question here from Sam, and Sam asks, from a technician standpoint, would there be any maintenance, cleaning, etc.? So we do recommend, for the purpose of education, that the ASL 5000 is calibrated once every 2 years. So every couple of years, we would ask that you send the ASL 5000 to us here in Pittsburgh, Pennsylvania at IngMar Medical, and our calibration and service lab would be able to recalibrate the device to be sure that it is as accurate and repeatable as it's meant to be. But otherwise, there is no regular maintenance required. So Jackie asks, when the scenario has the vent settings change, does that occur automatically, or does a person have to make the actual vent change? So as you probably guessed, we are not in control of the ventilator. So that means the learner will really be focused on making those changes to the ventilator. And it really is actually a matter of the instructor reacting to those adjustments. So the instructor, as you saw in today's scenario, would essentially be observing the decisions made by the student. And then based on those decisions and adjustments, they would be adjusting the patient's condition accordingly. So a question here from Tyler asks, how is this plugin installed on LEAP? So there is an executable file that represents our ASL 5000 plugin, and you would run that installer. And it does require you to have LEAP version 6.3 or higher. But as long as you have LEAP version 6.3 or higher, after you've run the executable installer from us, then you would suddenly see our new ASL windows when you open LEAP the next time. And these windows would be in the same area where you access all of the other windows within LEAP. They would just be situated at the bottom under plugins. And of course, that means they could be toggled on or off, and they could be used to create your own custom layouts specific to your scenarios. So those of you familiar with LEAP know that these windows can all be dragged around and configured in your own custom layouts. So that is no exception to our windows as well. We have a few questions here about the noise created by the system. How loud is the ASL 5000? And I can say from my own experience that it does make a little bit of noise that is coming from the piston moving inside of the cylinder, but you have to be very close to it to even hear that. And in fact, if you have a real ventilator connected to your system, in my experience, I found that you don't hear the ASL 5000 running at all. In fact, the ventilator being controlled by a compressor, for instance, would be much louder than the ASL 5000 itself. And we just have a number of people here thanking IngMar for putting on the webinar and for trying to make this information clear to everyone. And I would just say, first of all, you're very welcome. But again, thank you, everyone, for supporting us in this effort. It's been an exciting ride so far, and we're really excited to keep working with Laerdal on this collaborative effort. So I think that's all we had for you today. But if there are questions that we left unanswered, we will have record of those, and we would plan to reach out to you as soon as possible. Again, thanks everyone for joining us today, and we hope to continue doing webinars of this kind going forward. Thanks again.